Всем привет! Это Дмитрий Плешков, компания Техноинфо. И сегодня у нас в гостях президент корейской компании NeoScience. Hello, Mr. Yu.
Hi, Dmitry.
Nice to meet you here in Russia. I hope you enjoy your time staying in Moscow. Right now, during last 2 years, a lot of new companies entered Russian market, and people want to know with whom to deal in this situation. So, please describe a bit about your company history.
Yeah, actually, I studied biology, and after my master's degree, I work at the government institute. I experiment in vivo imaging system first. After that, I started a PhD degree, but personal reason I cannot continue the PhD degree. So I entered my brother's company, a scientific equipment sales company. So my background is researchers and sales equipment. So I think that I can develop the in vivo imaging system. Meanwhile, our professor, one of my customers asked me making the in vivo imaging system. That was a very good chance to me. So I developed the in vivo imaging system and offering him. He satisfies, and the function is more than I expected. So I decided to make it commercialize it.
Why do you think, what is the reason of such success for this small instrument?
Actually, our competitors make the bioluminescence, fluorescence, make one devices, but we make them separately. Then we can make it faithful function, and we can make this simple, and then we can make a smaller and simpler and easy to use, and maintenance is easy.
Okay, so people like easy to use, and they like when you can buy small and cost-effective unit.
Yeah.
Okay, so this is Phobos. So the very first was fluorescence imaging system. Then you introduced luminescence, right?
Yeah.
So can you explain quickly what is the difference?
They have similar principles because they both of them is optical in vivo imaging system, but they use a little bit different materials. For luminescence, cancer researchers using the luminescence imaging system, and drug delivery system researchers using the fluorescence. The application is a little bit different.
Luminescence is mostly for cancer research, and fluorescence is, for example, for drug delivery.
Yeah.
And pharmacokinetics, I believe, pharmacodynamics. And
a little bit different, actually. Fluorescence imaging is for protein drug developers uses, not chemical drug.
Mm-hmm.
Yeah, so nowadays, drug targeting is a hot issue. They want to track the drug inside the body, so they can label the drugs labeled with fluorescence. That drugs is not chemical drug, the protein drug. That means the peptide or antibodies, and then they inject the drugs inside the mouth, and they can track with the imaging system, like a fluor eye. Yeah.
Mm-hmm. Okay, so it's again fluorescence.
Actually, the in vivo imaging is not difficult, but if researchers doing that at the first time, they make the mistake at the design the experiment. So also I don't know about the materials well, So I can ask them what is the materials, what characters have the materials, and then I can suggest them the good imaging experiment.
So you can help with experiment design.
Yeah.
Who is your main customer?
Laboratory in the university, especially pharmaceutical department, medical department, and the biological department, and the government research institute, and especially for the process, the drug delivery systems uses the process imaging system, and cancer researchers using the luminescence imaging system.
Do you sell a lot abroad, not only to Korea? So now you sell to Russia, we know that. And what about other countries?
Actually, we sell some in China and in the USA. Last year, I visited Germany and Poland for our conference related with the In Vivo imaging system. There are so many customers interested in our products.
In Russia, everybody knows IVIS spectrum. People always ask, is the Fobi really direct competitor to the IVIS spectrum?
Yes, sometimes it is competitor, or sometimes it is not, because we make them have a very low cost. The price difference is very big, so
it's enormously huge.
if they apply to the bid, they cannot compete because of the price differences.
But on IVIS you can do both luminescence and fluorescence, right? So here you need to choose either fluorescence or luminescence. And actually I constantly been asked this question, like, can we combine this in one instrument? And always I ask the question, okay, now I can see you're working with fluorescence. Do you have something for luminescence? And usually answer is no. So people think they do need both luminescence and fluorescence, but actually they don't. What is your experience?
Actually, the specifications for luminescence and fluorescence is different. If you make it luminescence imaging and fluorescence as one device, it could very complicated and very huge and very expensive. But for the fluorescence, you don't need so high sensitivity camera. But for the fluorescence, you need a very optimized filter for the remove the background, and so the specification is totally different. So
you mean that it should be two different instruments with completely different specifications?
Yeah.
Or one instrument which will be very expensive?
Yeah.
But you have in portfolio two more instruments. It's gel-doc imaging system. So can you tell a couple of words about Fluorobox? What is it for, and what is the idea of alternative green reagent that you're using with this instrument?
Yeah, we have two more devices. First one is a fluoride gel. That is a gel doc. That image system get images, DNA gel images, and analysis. So, and then the LumiEye Western. When the researchers analyze the protein, they do the experiment named the Western blot. Nowadays, they get images of Western blot using the devices, imaging devices. So we make the LumiEye Western.
Mm-hmm. Yeah. And talking about first about Fluorobox, the idea of the instrument that you're using alternative reagent, neogreen, right? And I did a quick research. I talked to the people, and it's very controversial because many people, they're using ethidium bromide, right?
Yeah.
And everybody knows that it's cancerogenic and it's not good for the health, especially for ladies. But I especially asked two ladies what they think about it, and one of them don't like it at all. She agrees that it's not very good reagent. Another one, she told, like, if you are wearing gloves, if you are doing everything according to the protocol, you are safe. What is your comments on that?
Sometimes they have to using the EtBr, even though even EtBr is a very strong carcinogen. When they have to check the molecular weight, they have to using the EtBr. But other cases, if they want to just the intensity, that means the amount of the DNA, they can use the alternative reagent. They can use the alternative reagent. So in the case, our neogreen is very good. Our neogreen have very strong signals and easy to use. So actually, the method is 100% the same with the EtBr.
Is ethidium bromide is really cancerogenic? Because many people write that it's just advertisement and marketing, and or cases, or personally from the community in Korea, for example, do people prefer alternative reagents? Do they like to be on the safe side?
Actually, if you wear the polyglove in your hand, it is safe. But anyway, there is a very strong carcinogen. So about 5 years ago, researchers don't want to using the EtBr. Mm-hmm. So the EtBr alternative reagent sales are growing from the 5 years ago. So nowadays, I think more than 50 laboratory using the EtBr alternative reagent. I think alternative reagent will grow in Russia too in the future.
Because we have your instrument. So, and talking about Western blot imaging system, I believe it's a direct competitor for Chemidoc system from Biorad.
Our Chemidoc is also very simple. So it also easy to use and easy to handle, and we have a lower cost.
And what about specifications? So your Western blot system does it offer some unique features, or it's just a camera to get a proper images?
Yeah, it also very simple. So there's a dark room and camera. That's all.
Yeah, actually, I also did some research. I asked my friends who are working in biology, and all of them told, like, what do you need from Western blot camera? You need just camera which takes images, that's all.
Yeah.
But you also have software to work with these images, right? So can you tell a bit more about this software? What can you do for the Western blot?
Other companies have very many functions in the software, but key point is get the image well, mm-hmm. and they want to merge with the normal image and the signal image, and they want to get the quantitative data. That means the area. They have to get the area and the intensity. We can do that, but we removed the other function not needed.
And we haven't discussed the software for fluoride Lumia systems, but it's important. It's the same software, right? It's called NeoImaging.
Yeah.
What are the functions? What can you do with software for the fluoride, for example?
Yeah, our program is very intuitive. You can recognize all function on the screen. There's the icons on the screen. If you see the icon, you know you can guess what is the function of this icon. So customers can use it very easily. I don't get the core, any course for the how to use the software. Yeah,
It's actually a good point. It's the same software for Fluori, Lumii,
yeah,
and for gel-doc systems.
Because the functions are almost similar, but a little bit different. So if you connect to the Fluori In Vivo, the interface, the changes optimized to the Fluori In Vivo. And if you connect to the Lumii In Vivo, the all interface changes for that.
So if you have two instruments, so you have the same interface for both of them, so very easy.
In that case, you can choose the devices.
What are your plans and ideas for future development for next 5 years, for example?
Actually, I don't have the merged the two images as one devices because, as I told you, their principles are a little bit different. But I want to focus to their own function. So I want to develop the have a more function for the Fluori In Vivo and Lumii In Vivo separately. Mm-hmm. For example, I upgraded a few months ago. Actually, previous version, we have to adjust the focus to depend on to the channel because there is a different wavelength. But we upgraded the lens to the hyper upper lens, and that no need to adjust the focus to the different wavelengths.
And what about, I know that you're working on NIR2 system for imaging in IR2 region. When we will see a new instrument, or what can you tell about this development?
Actually, we have a beta version already. So we tested several times. So we have Fluori In Vivo NIR2, but there's not much reagent for NIR2. So and that reagent is not strong yet. So it is difficulties to sell the Fluori In Vivo NIR2. But in the future, that reagent will get stronger. So for that, we have to prepare the Fluori In Vivo NIR2.
What is important for the anesthesia system?
Yeah, anesthesia system is needed for Fluori In Vivo and Lumii In Vivo, but actually we cannot make that system because it needed a license. You can assemble the tube using the tube, the anesthesia system. So you can use any brand anesthesia system in Russia. So especially I want to recommend you IWD brand from China. So
okay, so using these systems.
Yeah.
Thank you very much, Intag, for this discussion. I'm enjoying the time with you during this roadshow.
Thank you for inviting me, and you prepare the roadshow, and I hope that we can make a good result together.
Okay, thank you.
Thank you.